This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. We have what I think is going to be a very interesting episode for you. This episode is titled Specific Strategies to Lower Your Overhead. And this is especially relevant today, given the inflationary cycle that we're in, where all of us are experiencing rising expenses. So I'm going to talk about how to specific strategies to combat the fact that we have higher expenses now that are somewhat outside of our control, and yet still get the overhead targeted at where we want your overhead to be. I think you're going to really enjoy this episode. Before we get into it, two announcements to make. First announcement is coming up shortly after the publication of this episode. About 2 weeks later, we have our next Thriving Dentist Masterclass. This one is on November 1st, 7 to 10 p.m. Eastern Time. And this masterclass is titled 6 Steps to Successfully Resign from PPO Plans. In that masterclass, I'm going to literally walk through with all of our attendees a blueprint to follow to successfully resign from PPO plans. Of course, that strategy is very relevant to our podcast episode today, because once we quit handing all of that money to the fat cats at the insurance company in the form of those insurance adjustments, all kinds of positive things happen with increased income in your practice and lower overhead. So these kind of go hand in hand, but come join us. It's November 1st. It's done in a live stream format, 3 hours. You get 3 hours of CE. It's done in a live stream format where you attend from the comfort and convenience of your home or office. And it's done live, though, so you can ask questions. Done more like a workshop than a lecture. This is our signature masterclass. All of our masterclasses sell out. Even though it's virtual, we do limit attendance because I like to run it more like a workshop than a lecture. If you'd like to register, tuition is less than $90, very affordable. You get 3 hours of CE. Go to thrivingdentist.com/masterclass. Hope to see you there. Second announcement, we have a returning guest, Dr. Jared Williams. And Jared's going to talk to you about tips for removing bony impacted wisdom teeth. If that's something that you have interest in or you'd like to advance your skills in removing wisdom teeth, Jared's going to share with you some great tips that's going to lead to not only successful clinical results, but more confidence on your part. You're going to enjoy this clinical tip from Dr. Jared Williams.
Hey guys, have you ever been in a scenario where your confidence wasn't there and you had a patient who wanted their wisdom teeth out, but you didn't feel prepared? Well, in this video, I'm going to share with you the tips that I use when removing completely bony wisdom teeth. Also, you're going to see a sutureless, surgical handpiece free third molar complete bony impacted wisdom teeth. Now, I know that was a lot, but in this video, you're going to see just how easy it is to do third molar surgery. I'm Dr. Jared Williams, your third molar expert, and if you want to take your skills to that next level, I suggest you get a pen and paper and watch this video multiple times. All right, guys, so anytime I'm looking at a case for third molar surgery, I always want to isolate this inferior alveolar nerve. And what I'm looking for to see is how close these roots are in communication to the IN. If the roots are far away, then I can move fast. If they're really, really close, then I have to move slow. So let's jump into it. So as you can see right here, I am making my flap. And when you're making your flap, the reason why I'm able to do suture-free third molar extractions is because of just this flap. So after I go over my flap several times, I definitely want to go ahead and reflect the tissues so I could see exactly where that tooth is. So I would definitely caution you about reflecting tissues on the lingual and just stay on the buccal side, as you could see right here. And I'll go ahead and I'll put my elevator in, and as you can see, the tooth is already basically ready to come out. Now, this is something that I very seldomly see surgeons, GPs, or just everybody else in between fail to do. They don't protect the patient by putting a throat pack in. So make sure you do that. So then what I'm doing is this, I'm just gently elevating, and you can see that this tooth is really ready to come out. Now, this is not any magic here when it comes to videos. You can see how quickly and easy this tooth is simply coming out. I like to use my cotton pliers to remove third molars just for the simple fact it allows me to determine how much pressure I'm actually putting on the tooth so I don't tear any nerves or break any bone unnecessarily. Once that's done, you can see how that flap already wants to close already. But what I'm doing is I'm inspecting the 12-year molar to ensure that I didn't cause any damage. And I'm removing any tissue tags that were left in sight. If you don't remove those tissue tags, what could happen is that tissue could end up becoming a cyst later on. But I caution you to, when you're removing this tissue, because sometimes you could be removing tissue and the nerve. So if you are still uncomfortable with that, I would definitely recommend getting more training. All right, so once this tissue is removed, what I want you to do is I want you to see that we're going to go ahead and inspect the area, and then we just throw the gauze in there. But I just want to rewind back just a little bit because we went very fast there. As you can see right here, you saw the tissue just flap back over onto the site. That's what I mean when you don't need to use sutures and you don't need to use a surgical handpiece. All right, guys, I want to let you know that's how easy third molar surgery can be when you choose the right cases. Once again, I'm Dr. Jared Williams, your third molar expert, and it was a pleasure showing you some of the same techniques I use in my clinical practice on a daily basis. All right, guys, remember, you deserve to smile after surgery. Make it a great one.
Hello, everyone. Welcome to the Thriving Dentist Coaching and Action segment. This is Narain, your co-host. I want to take a minute to thank Dr. Williams for that awesome tip. You can go to the show notes and watch the video. We'll make it easy for you to find it. It's an awesome tip. Thank you, Dr. Williams. Tips to remove completely bony wisdom teeth. I also want to remind everyone about the upcoming event, the big event Gary and I are hosting, the RIDA Summit. It's on October 27th. It's 5 hours of CE. The website is rid.academy, just less than 10 days, less than a week actually, rid.academy. So if you want to grab a last minute complimentary ticket from Gary and I, check it out. The topic today is specific strategies to lower your overhead. Specific strategies to lower your overhead. I still remember this conversation I had with this famous doctor in New York City. And after, trying to figure out how much money he makes versus how many hours he worked, he came to the realization during our chat that he was making like $40 an hour. And he's one of the most well-trained people I know. And he was working 70 hours a week. It was crazy. Overhead can kill a business. I mean, there are so many people who sound great on paper. They're making a lot of revenue, but their overhead is so high. They're working so hard, and the juice is not worth the squeeze, like Gary likes to say it. And this has become even more of an issue since COVID, because all of us know that expenses have gone up literally across the board. Wages are up 20 to 30%, if not more, post-COVID. In some cases, the amount of money that doctors are paying hygienists is more than what they get reimbursed in many, many, many cases. So in other words, they're losing money on every hygiene patient. So Gary's going to, get into some details and talk about specific things you can do to reduce overhead, to lower overhead. Gary, I cannot wait to talk about this topic because, what's the point of working so hard but not having anything to show for, right? I mean, it almost beats the point. Might as well quit. This particular doctor that I was telling you about, he literally quit. He said, I don't want to do this anymore. I would rather work for somebody else, not have the stress, make more money.
Yeah. It's that, that's just is the reality for so many, and it doesn't have to be that way is the good news. Well, let's start by benchmarking. And if we don't have targets, we want to use that wonderful habit number 2 from Stephen Covey, in his book, 7 Habits of Highly Effective People. Habit number 2 is effective people begin with the end in mind. So let's begin with the end in mind with some benchmarking. First of all, is an overall benchmark. For a general dental practice, where should your overhead be? Where should your overhead be? Again, I'm talking about general dental practice. The numbers will be different for a specialty practice, but for a general dental practice, what we shoot for with our clients is overhead no higher than 60%, no higher than 60%. And that would include all of the necessary expenses to run your practice, with the exception of owner dentist compensation, owner dentist compensation. So that's the only thing that isn't included, in that 60% overhead. So we want to get your overhead to 60% or less. Now, it's becoming more and more difficult to do that, especially with rising costs. That's what this episode is about how, at the time we're recording this, when we're under increased inflationary pressures, how do we lower your overhead to get that 60% or less overhead? Now, I can confidently tell you that everybody listening to this can get their overhead to 60% or less. Now, why can I say that so confidently? Because we have done this with my coaching with hundreds and hundreds and hundreds of clients, where they'll start much higher than 60% overhead. And we get that overhead down to 60% or less. So I can say it confidently because if it's been done before, it must be possible. Now, I will add that in an inflationary cycle like we have now, there's nothing going to be easy about this. It's going to be difficult, but it is possible. And without that, I think we have to start with that positive approach, positive mindset. Because if you believe it's impossible, you're already half defeated before we ever start.
Gary, can I brag on you for a bit? I still remember the very first client that I got to experience since I started working together several years ago. I believe he was doing 1.5 million at the time, PPO infested practice. And he started with you, and before he knew it, within 12 months, his profit went up by $300,000. He was just blown away. He has been practicing a certain way for 20 years. You just told him, or you just helped him find $300,000 in terms of profits just by making some changes. And he was working less.
His practice was plateaued, not only in, collections, right, but also in his net income. In fact, actually been going down a little bit every year because of increased cost, wage increases, and so on. But it had been going down. And in our first year of working together, not only did his top number go up because of increased production and collection, but his bottom line increased by $300,000 a year in direct bottom line profitability, direct to doctor. And we'll talk more about that as we go. But let me continue with benchmarking. So while any dentist listening to this, if you look at your profit and loss statement, you're going to have anywhere from 40 to 50 line items of expenses. When you look at your profit and loss statement, there'll be 40 to 50, depending on the size of your practice. And I really only care about 5 of those line items, because 5 of those line items of expenses, Naren, equal 85% of all the expenses in a dental practice. So let's say you've got a profit and loss statement that has 50 line items of expenses, and 5 of those represent 85% of your expenses. The other 45 line items only make up 15% of your expenses. Now, I'm not saying we shouldn't pay attention to those, because you want to be a good steward of your expenses, but let's focus on the low fruit on the tree, the low hanging fruit, which are those 5 areas of expense. So let's benchmark those 5 areas. The highest expense in any practice are team member compensation. And it's an all-in expense. Not only does it include their wages, but it would include their bonus. It would include all the related costs like FICA, FUTA, unemployment insurance, payroll taxes, payroll service. If you're doing matching 401k contributions, if you provide health insurance benefits, any expense related to hiring someone in your practice goes in that category. And the benchmark for that is 28 to 30% of your revenue, 28 to 30%. Now, I need to explain why that is a sliding scale, Naren. As all of us know by listening to or by simply experiencing what's happening today with the inflationary cycle. Wages are up radically in any dental practice. Wages are escalating rapidly. So recently, I had a chance to talk to a number of accounting firms that specialize in working with dentists. And I asked them if the 28%, which we've historically used, was still relevant at the time of recording this podcast when our wages are up so high. Is that 28% target still relevant? And here's what we came up with, that if you're on either coast of the United States, so if you're on the West Coast or the East Coast, or major inland cities like Chicago, St. Louis, Minneapolis, Denver, then the 28% is not realistic anymore because of the rapidly increasing wages. The target has to be 30% in those areas. So if you're on either coast, West Coast, East Coast, or major inland cities, I'd add Atlanta to that group, Atlanta, Chicago, St. Louis, Minneapolis, Denver. If you're in those cities, then the 28% is no longer realistic because the wage pressure is even higher. Your target is 30%, all in, 30%. If you're in anywhere else in the country, then you can still hold to that 28% benchmark. So there gives you some modern, completely up to the moment benchmarking for your wages. Number two is lab. And again, I'm going to use a sliding scale of 4 to 8%. And the sliding scale will depend on whether you're doing CAD/CAM dentistry or not, whether you're a CEREC office or not. If you're a CEREC office, then I use a budget of 4% for your outside lab because much of the lab single unit type stuff you're going to be doing with your CEREC. If all of your work goes outside to a lab, then I use a budget of 8%. And by the way, anytime I use a percent number, the percent is a percent of revenue, percent of your collections. So for example, if you had $1 million practice in collections, Darren, and you're a CEREC office, you've got a 4%, $40,000 annual budget for lab. If everything goes out to a lab, then you've got a budget of $80,000 a year for lab. Does that make sense, Darren?
Yes.
Yep. Number three is your facility cost, rent or mortgage. But this is also an all-in expense beyond just rent or mortgage. That would include repairs. If you're leasing space, common area maintenance. If you own space, that would include property taxes, all of that. Anything related to your facility. And my budget is 5% or less for facility. The fourth area is consumable supplies. And consumable supplies is 6% or less, 6% or less. And then finally, marketing. And I'm going to give you a new benchmark for marketing on this because this has been what we are consistently experiencing with my clients. The budget for marketing is 1 to 2% of your revenue, 1 to 2% of your revenue. Well, there's benchmarking. So now we've established with the top line, a goal of overhead no higher than 60%. And now we've broken it down into the 5 categories: team member wages at 28 to 30%, lab at 4 to 8%, facility at 5% or less, consumable supplies 6% or less, or marketing at 1 to 2%. Now let's talk about what, as you analyze that and you look at your profit and loss statement, how do you lower your overhead? And I'm going to talk about, where the boat could be leaking. Imagine that you're in a boat and there's water coming in. There's water coming into the boat. Where's the boat leaking? Where your profitability may be leaking in your practice. For example, if you have a facility cost that is, say, 7% annual, then that's 2% above my benchmark of 5% or less. That may mean that you're not producing enough in order to afford the space that you're in. And the same thing if your wages expenses are high. Your wage expense would mean you're not producing enough to support the team that you have. And while we can all find savings by scrubbing your profit and loss statement, the scrubbing is a useful exercise. And it's something I think every one of our listeners should do. You should quite literally, if you haven't done it in a while, take a look at all of the expenses that go in every one of your, especially those 5 items of expenses, everything that goes in there, and see what you can do to lower that. And oftentimes we find when I do that exercise with my clients, we often find opportunities to save money which represents, part of the ways we're going to reduce our overhead. But while I would encourage you to look at that, let me also tell you that there's bigger fish to fry. In other words, there's better approaches to increase your overhead, or increase your profitability, lower your overhead. There's better strategies to lower your overhead. And one of the important things to do is consider a growth strategy. If you can grow your practice with the same team and the same hours, if we can grow your practice, and let me use a round number that makes it easy to do my math, Naren, if we can grow the practice, same team, same hours, the profitability is quite impressive on the growth dollars. Let me walk you through that exercise. And I'm going to use $100,000 because it makes the math easy. Plus, I believe every one of our listeners could grow your practice by $100,000 in collections. And I'm specifically talking about collections here because it's got to be real and collectible. All right, so let's look at that. If we grow your practice with the two disclaimers of same team and same hours, then we have to look at your fixed and your variable expenses. Most of your expenses are fixed. Variable expenses are those that change as a result of doing more dentistry. And there's really only two categories that will grow as a function of doing more dentistry, assuming same team, same hours. And that would be lab and consumable supplies. Because again, your lab bill is going to go up if you're doing more dentistry, because some of it's going to be lab related. So let's say you're a non-CEREC office and our budget's 8% for lab. So let's use 8% for lab. And then your consumable supply, because the more materials you use, the more your expenses will go up. And so that budget is 6%. So add that up, Naren. 8 plus 6 is 14%. Now, theoretically, in theory, those are the only expenses that will go up as you do more dentistry if we do it with the same team and the same hours. However, something always seems to creep in there and somehow other expenses creep up along with it. So I'm going to put a miscellaneous category of 6% because it makes a round number, 14 for lab and consumable supplies, add another 6 to make 20%. And the 20% is just the miscellaneous stuff that seemed to go up. Maybe we use the pillowy soft toilet paper now, and it goes up. So 20% is your overhead on the growth dollars. Remember, we talked about growing $100,000 a year. So you're going to have another $80,000 in net income if we could grow your practice $100,000 a year. That $80,000 additional dollars certainly is going to be welcomed by any of our listeners. That's not, I don't care what neighborhood in, that's a very attractive increase, $80,000. It may not get your overhead, depends where you start at, but it may not get it down to 60%, but you're going to be trending in the right direction, Now, if you'll take a leap in faith with me and let's do it again, let's say you could grow another $100,000. So you're going to grow $200,000 total, same team, same hours. Then you grow, same math again, another $80,000. We add another $160,000, the 80 from the first 100, the 80 from the second 100, straight to your bottom line. Think about that, Naren. Think about how attractive that is. Not only, giving an extra $160,000 to reduce debt, to invest in your technology, to invest in your CE, perhaps just to pay yourself more. Let it go right down the bottom line and pay yourself a more appropriate way, so you don't feel like that dentist or that doctor that you mentioned in New York that felt like it didn't make sense to own a practice. So one of the best things you can do is you can adopt a growth strategy. And that's exactly what you did in the example that you gave, Naren, of the client of mine that was stuck. Now, he was stuck. When we started together, he was stuck at a pretty good place. He was stuck at $1.4 million a year in collections.
Right.
Solo doc, strong hygiene department. But he said, Gary, I've been stuck here for 4 years. I haven't gotten any increase I tried, but I haven't gotten any. So that's why I wanted to start working with you. And we grew the practice significantly, resulting in another $300,000 in net income to the doctor, a very favorable end result. So I use that as an example, and growth, it speaks to why growth is such a great strategy. The second way that any of you can radically reduce your expenses is to successfully resign from PPO plans. You know, that 45 to 50% you're handing to the fat cats of the insurance company is eroding your profit and loss statement like nothing else. And the sad reality is most of you don't know what you're writing off because you enter your contracted fees, you know, into your fee schedule rather than your UCR fees. And all three major practice management software encourage you to do that. But if you can reduce your insurance dependence, and I'll give you a case study example here. Actual client of mine, I won't use the name, but I'll use the numbers. In 2021, this practice was in network with about 10 PPO plans, 10 PPO plans, the entire year. And in that year, he produced 1.9 and collected 1.4, 1.4. Had $500,000 in write-offs, and almost all of those write-offs were insurance adjustments. All right. In 2022, by the end of 2021, he was right out of network. He was getting out of network. And when we started 2022, he was completely out of network with PPO plans. In 2022, his office produced 1.8. So his production went down from 1.9 to 1.8 because of the attrition of some patients that left because he was no longer a PPO provider. But he collected 1.7. So Naren, look at that for a minute. So 300,000 from one, from 1.4 to 1.7 in collections, another $300,000 better.
So he's doing $100,000 less in dentistry, but he's collecting 300,000 more. Same team.
And so what happened to his overhead?
His overhead goes down because he's doing $100,000 less in dentistry.
The overhead's now instead of based on 1.9, it's based on 1.8. So some of you might be saying, well, wait a minute, if he's fee for service, Gary, how come he has $100,000 in adjustments? Well, primarily because of his in-office membership plan. I don't like that 10% discount off of the in-office membership plan, but I like it a whole lot better than the 45 to 50% done by the PPO plans. So and look what happened to his profitability in that situation, went up radically. So the two specific strategies I would encourage you to focus on is growth. You can grow your way through this. And if you're a PPO practice, you can produce your way through this, even with the adjustments, but it's going to mean you have to pedal a lot faster, which may or may not be desirable for you. Or you can reduce your PPO plans. And by reducing the PPO plans and reducing what you're handing off to the fat cats of the insurance, you are increasing your profitability. Well, Naren, with that, let's hit pause on the coaching and action segment. And we've got 4 great questions coming up in the Q&A segment where we'll go into deeper strategies about specific expenses.
Welcome back to the Thriving Dentist Q&A segment. Gary, I really enjoyed the coaching and action. I think this is one of those sessions where those listening today can literally make some changes tomorrow or the next working day and start implementing some of these strategies that directly flow to the bottom line, directly flow to the profits. And sometimes, you can work hard or you can work smart. I love the 2 strategies that you shared with us, the big strategies. One is reduce your PPO dependence, and the other one is grow your revenues with the same team, same hours by $100,000 to $200,000. I love those because these are very smart strategies, have the biggest impact with the. I have 4 questions for you. Let me ask question number 1. I appreciate your update regarding benchmarking team member wages. Is it even possible today to have my team member wages at 28% or less, given that I am part of a PPO practice?
So this doctor must be not from either coast or the major cities in the inland part of the United States, because that, if you're on either coast or in the major cities, then it's going to be more like 30%. So this doctor acknowledged that he or she has a target of 28%. And is it realistic to have team member wages at that if you're a PPO practice? Well, Naren, it's becoming harder and harder. I'm an optimist, and I would like to say, yes, it is. However, I'm reminded recently a new client of ours in our coaching from California shared this with me. He said, Gary, I've now, thanks to listening to your podcast, I now am way more tuned in to what my adjustments are with my insurance companies and with my PPO plans. And I have some very bad PPO plans in my practice where I'm not getting enough reimbursement for the hygiene appointment to even cover the hygiene wages per hour. I'm not getting reimbursed enough to even cover their wages per hour. And he goes, Gary, I know that's not enough for me as a business because I have other expenses associated with that hygiene appointment. I have the room, I have the the equipment costs, I have the supply costs, I have the infection control costs, I have the admin costs to put a butt in the seat in the first place in hygiene. But I'm not even covering the hygiene wages under those PPO plans. So basically what he's saying is it's costing me money to provide those patients with care. And if that's the case, and again, those would be the most offensive PPO plan. Not all PPO plans have the same fee schedules. Of course, they can vary all over the map. But if you start to get to know your PPO fee schedules, and that's something I would recommend for anyone listening, you need to get in the weeds about those PPO fee schedules and find out, do you have plans where it's actually costing you money to provide care? Well, one of the ways you could reduce your overhead is stop seeing patients under those PPO plans, because you'll stop the bleeding. It's kind of like emergency, imagine, emergency first aid, Darren. If someone has a severe laceration in their arm, the first thing you need to do is stop the bleeding. And we may need to apply a tourniquet if the bleeding is enough, So doctor, the tourniquet you may need to apply is to just resign from any of those plans where you cannot make a profit to provide the care. Unless you're independently wealthy and you want to just take care of people, but I doubt that that's the case with many of our listeners, with any of our listeners, perhaps. So apply that tourniquet. Now, doctor, there may be some plans that you have that have better fee schedules, and perhaps it is possible to have your wages at 28% if you maybe cut down the number of plans you're at to those that have an acceptable fee schedule. But I would probably use your hygiene appointment as a benchmark for that, because you can simply look at it very simply. And of course, the hygiene is more than just the pro fee. If it's a healthy adult, it might include x-rays and exam, and look at that and see if you're getting enough reimbursement to where it is a profitable service. And if it's not, it's an easy decision for me. If you're losing money to provide that care, then I would strongly consider dropping it. I'm reminded of a young dentist I met one time at a course that I was giving. And he said, Gary, I know I'm losing money on this plan, but I figure I'm going to make it up in volume. And he was dead serious about that, Aaron. He said, because I still have openings in my schedule, I'll make it up in volume. And I said, doctor, if you lose money every time you see a patient and your volume increases, you actually just lose more money. And he looked at me and he said, yeah, that's why I wasn't a math major as an undergrad. And he smiled at me. And he goes, I just got an aha moment. Thank you, Gary. So yes, it is possible, but you want to scrub those plans. And that's one of the things we do when we work with clients. We scrub the plans to look at, what are ones that are just flat out, a loss. It costs us money to provide care. And those become the easy ones to drop because it doesn't make sense for you to pay out of your pocket to provide care.
Thank you, Gary.
Great question.
Appreciate it. Let me ask you the second question I have. I think this is an awesome question as well. I'm considering investing in CAD/CAM technology. Do you see this as a useful way for me to lower my overhead?
Well, great question. And on one hand, the lab expense goes down from 8% if you're non-CAD/CAM to 4% if you are. So, hey, you think on the surface, that 4% represents a lowering of my overhead, but it doesn't include the cost of the investment in that technology. So it's not quite as easy to look at just 8% to 4%. Wouldn't I be better off having that? What you can do is figure out, estimate how many units a month you would provide, how many units a month you provide. And you might go back and look at your records and look at your Crown and Bridge and figure out how many units you're doing, and see if the savings would allow you to make that lease payment or make that loan payment to purchase CAD/CAM technology. And it could be that you have enough volume in your practice to have it be a lot less expensive to actually have CEREC. But I'm going to give you a little different way to look at that. So you could look at mathematically, and you could determine it based on volume. But I wouldn't make the decision solely on seeing it as a cost savings. If it's technology you're excited about, and I will tell you, I'm excited about CAD/CAM technology. I think we have the materials now that allow us that, in the past, the limitations didn't have so much to do with the image capture and the milling. It had to do with the materials. Today, we've got some amazing materials. If you're excited about that and your practice has a technology orientation and you have a community that maybe is interested in offices that are a little more technologically oriented, then I would invest in it because it becomes a better service in your practice. Not necessarily it allows you to save a lot of money. Maybe it's a wash in terms of money, but now you can, run the technology component of your practice up the flagpole. The other reason is that if you can do it in a single visit restoration, where you mill it and provide it in one visit, the benefit, the ability to market same-day dentistry is very appealing from a marketing experience. You're a marketing expert. For a patient to receive a crown in one visit compared to 2 visits, pretty easy to sell the one visit restorations, isn't it?
100%, Gary. Yeah, I mean, time is the biggest thing we don't have today, right? Most of us, if not all of us. So if you tell a patient, hey, we can do this today, versus, oh, you have to come back 2 or 3 times. It's a simple yes, because of course they don't want to come back 2 or 3 times.
Yeah. And if the way you use CAD/CAM does not result in the same visit, then that argument goes out the window.
Right.
Then you'd have to justify it purely on the financial side. But what I'm trying to say in my answer is that there's other ways to look at it than purely financial. In other words, it might be an enhancement that would allow more people to choose you because of the technology. You may really enjoy it. If you really enjoy the technology related to it, then that by itself might be a reason to add it. And then just make sure you're doing enough of it to justify, the investment in the technology and the cost compared to using a traditional lab. So it certainly could make sense for sure.
Thank you, Gary. Let me ask you the third question I have. I have an interesting dilemma. Currently, most of my new patients are coming from Google pay-per-click, and I'm spending 6% of revenue on marketing. You recommended 1 to 2%. With the desire to reduce my overhead, what are your thoughts?
Well, pay-per-click is an expensive investment. It can work. Pay-per-click can work, but it's expensive. And what we found, by the way, I have pivoted my thinking on what the appropriate benchmark is for marketing. For many, many years, I taught that appropriate marketing budget was 3 to 5% of your revenue, 3 to 5. 3% was if you had lower growth aspirations. Maybe you wanted to grow single-digit percentage growth, 4%, 5% a year, 7% a year. Then I said the 3% of your revenue. But if you had more aggressive growth goals, like many of you I hope have, I know I teach my clients that I want them to grow by at least 10% a year. And that would be on years where we weren't adding more providers. So we're not adding more hygiene days, we're not adding more doctors. And in years where we're adding more providers, then we're going to adjust that goal above 10% to factor in the increased growth that we anticipate from the providers. But if you want 10% growth, then I was recommending more like 5% of your revenue. So again, you go to that $1 million practice, 5% of revenue is $50,000 a year. How 3% of revenue would be $30,000 a year. However, not only at Life Smiles, but in my client work, I found that we can consistently get that percentage to 1 to 2%, 1 to 2%. And that represents a pretty big savings. If you were at 5% and we now get it to 2%, if you're that $1 million practice, we just saved 3%. We just saved $30,000 that went right to your bottom line. And the simple answer to that is do what we did and start working with Equa. Equa is the digital marketing agency, Naren, that you founded. You're the CEO of. We started working with you almost 7 years ago, not quite, but almost 7 years ago. And we've seen fantastic results. After a year of working with you and seeing the results, I started recommending it to my clients. And we see the same results over and over and over again. Our clients are consistently able to get that as a percentage, 1 to 2% of their revenue, depending on the size of the practice, 1 to 2% of their revenue. If you'd like to learn more about that, I would encourage you to schedule a marketing strategy meeting. You can do that by going to thrivingdentist.com/MSM, stands for marketing strategy meeting. And you'll have a Zoom meeting with Lila Stone, the director of marketing for Equa, and she'll explain all the different things they can do as part of that marketing that will get that overhead to 1 to 2%. And, Naren, I'm not letting the cat out of the bag because you're very transparent about it. You're able to do that primarily through an awesome organic search engine optimization strategy. So our clients, for the most part, don't need to do pay-per-click because the pay-per-click is expensive. However,
Yes.
we're mastering that through organic search engine optimization. Here's a further reason to justify organic SEO. And we have this data from Google. We didn't make this up. This comes from Google. If a patient finds you by clicking an ad, a pay-per-click ad, they will spend 15 seconds on your website. So maybe the ad intrigued them. They click it. The amount of time they're going to spend on your website is 15 seconds. 15. That's it. That's it. And the reason for the short amount of time is they have a built-in suspicion because they know it's an ad. However, if someone finds you organically, meaning you weren't in the ads, but they found you by being listed on page 1 on Google, they found you organically, you didn't pay Google, they spend 90 seconds on your website. 90. Now, 90 seconds isn't a whole lot of time, Naren, but it's 6 times the pay-per-click visitor that spent 15 seconds.
Exactly.
So another way we enhance our results, I believe I have much better chance about getting someone to call the office and make an appointment if they spend 90 seconds on the landing page instead of 15 seconds. So there you go. And so my thoughts on that, doctor, go to thrivingdentist.com/Equa. Equa.com/MSM and schedule a marketing strategy meeting and see how you can get that overhead to 1 to 2%. Instead, did I hear 6% in the question, Aaron?
Yes, 6%.
Yeah, there you go. You can get that down, depending on the size of your practice, to more like 1 to 2%. And for many of our clients, that's all they do. All they do is organic search engine optimization. Naren, you have a fixed monthly fee. It's all inclusive. It does no nickel and diming, no add-ons. It's something you can budget for. And it absolutely results. It results in great benefits in terms of lowering that marketing expense. Highly recommend.
Thank you so much, Gary. Really appreciate it. Thank you. We'll put that link, ekwa.com/MSM. Gary, let me ask you the 4th and last question that has been sent in to us. I have an opportunity to hire an additional hygienist who is a great fit, I believe, for our practice. I also believe we have the demand to fill the increased hygiene appointments. Do you think it makes sense to hire this hygienist given the higher hygiene wages all of us are experiencing?
Great question. And although let's recognize we are in an inflationary cycle with hygiene wages, they're going up increasingly. Nothing about that has changed my opinion about having a hygiene-driven practice. The stronger your hygiene department is, the stronger your overall practice is. You have more exam opportunities. You're keeping your patients healthier. You have more time to revisit unscheduled treatment plans. You have more time to cultivate, say, the high-value treatment, the seeds that you planted regarding high-value treatment. So, doctor, I can, without any hesitation, say, if you have an opportunity to hire a hygienist who you feel is a really good fit for your practice, and you have the demand, you believe you have the demand to fill those days, and there's ways mathematically we can figure that out. But I'm going to go on faith. I'll just trust you that you said you have enough demand. I would absolutely hire that hygienist in a heartbeat, Now, you may want to consider your PPO strategy, like we talked about earlier, but I would absolutely hire that individual in a heartbeat if they were a good fit and if you have a demand to fill those hygiene appointments for sure. Well, as we come to the finish line today, I hope I've given you some things to think about. And more importantly, I hope you take action on some of the things that you can do to lower your overhead and increase your net income. Doctor, you deserve to be compensated well for your care, skill, and judgment. And you deserve to be compensated very, very well for the risks that you take as a practice owner. And if you're not experiencing that, then it's time to take some action to make some changes related to that. By the way, in my coaching, we are accepting new clients. If you'd like help with any of this, you can reach out to I have a link that you can reach out to me and you can schedule a coaching strategy meeting. Just go to thrivingdentist.com/CSM. That stands for coaching strategy meeting. It'll be a Zoom meeting with me. The purpose of that meeting is for me to get to know more about your practice and for you to get to know about our coaching and determine if there might be a great fit. I would love to have you experience, Darren, if I bring it back full circle to the example that you used at the beginning, like our client that was plateaued. We radically broke through that plateau and added an additional $300,000 in net income. I'd love you to experience that. Hey, Casey, if you have any interest, I'd love to see you in a coaching strategy meeting. thrivingdentist.com/CSM. On that note, Darren, thank you for co-hosting this podcast with me. Thanks for all the amazing work that you and your team do for dentists all over the country to master marketing in 2023 and beyond. Also want to thank all of our listeners. If you haven't done so already, click the subscribe button wherever you get your podcasts. If you hit subscribe, it's free. It simply means that every Wednesday when we upload a new episode, it'll be automatically uploaded for your listening convenience. On that note, let me thank you for the privilege of your time and tell you that I look forward to connecting with you on the next Thriving Dentist Show.